All right, if you could please read that statement for me, please.
My name is Steve. I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as student, are not considered liable.
Thank you, sir. My name's Christine, and I'm going to be the one doing your head-to-toe assessment today. And what I'm going to start with is I'm just looking over your general appearance as I introduce myself, and I'm looking at your hair and your skin color and looking for any obvious abnormalities, which I don't see. I'm going to assess your hair. I'm looking for any ticks, scalp, dandruff, anything of that nature. I'm going to start feeling. And what I'm feeling for is any bruising, lesions, or malformations of the occipital, temporal lobes. I'm going to feel your temporal pulses here just to make sure there's no pulsations or which would be an abnormality at that point. I'm going to check the Turner, okay, your forehead and your skin, okay, checking your lobes, your orbital, your mandible. Okay. All right, I'm going to have you open your jaw for me and close it. And there's no snapping or popping. I'm just going to move your jaw to the side. Okay. There's no deformities there either. I'm going to work around to the front of your face. Feeling your sinuses. And is there any pressure, any pain or pressure when I press there?
No.
Okay. All right. Everything is symmetrical. There's no deformities or of any nature that I can see. And I'm going to just check your some of your cranial nerves right now. I'm going to check and see. Can you smile for me and frown and puff out your cheeks? Alrighty. I'm going to have you at this point check the sensation of your foreheads and cheeks. This is going to be soft or sharp, okay? And you just close your eyes and tell me what you feel.
Soft. Soft. Sharp. Sharp.
Okay. I'm not seeing any ticks or any facial drooping or anything of that nature, so everything is intact at this point. And now I'm going to go on to looking at your external eye, and the alignment is symmetrical. I'm not seeing any deviations or drooping at that point. Again, I'm going to look at the conjunctiva and your sclera, and it's white. There's no jaundice or yellowness noted. The conjunctiva is pink and moist. I don't see any capillaries, ruptured capsullaries, or anything of that nature. I'm also checking for any scleroedema, again, any swelling around the eyes or puffiness or bruising, and there is none. So that is a good finding. I'm also looking for your vision field. So what I'm going to have you do for me is I'm going to have you, I'm going to start with my hands behind your head, and you're going to tell me when you can see them, okay? Tell me when you can see them.
Okay.
You can?
Yeah.
Okay, then say what you said. I can't. Okay. And again, tell me when you can see them.
No.
Okay. And again.
No.
Okay. I'm going to have you cover your right eye for me. Okay. And I'm going to have you do is I'm going to check this eye right here. You tell me when you see it.
No.
Okay. And your left eye. Oh, my right,
No.
your left. Okay. But you knew what I was saying. Okay. My right, your left. So your field of vision is fine. What I'm going to have you do just checking your ocular motor strength. Again, I don't see any doll's eyes or anything of that nature. There you go. That can be difficult. And now what I'm going to do is I'm going to turn on my light, and I'm just going to check for reflexes first. I'm just going to check and make sure that they are brisk and they are constricting equally. And they're accommodating on either side. I'm going to turn off this light for just a moment. Alrighty, I'm going to have you look straight ahead over my shoulder there for me. And what I'm doing is I'm going to check your corneal. Oh, there we go. And it is red, orange, and intact. Sorry. And again on this side. Okay. So I'm checking again your vision and your accommodation to the light and the corneal reflex at that point. I'm going to turn the light back on so I can see you. Maybe. I'm going to turn the light back on. Let's try that. There we go. All right, so we've checked your head and your face and your eyes, and now I'm going to move on to your ears. Now that your vision field is okay, I'm just going to look for the symmetric, make sure that the ears are symmetrical. There's no tenderness when I palpate the auricle of the ear. That does not hurt or anything. There's no outer redness. Okay. All right, what I'm going to do is I'm going to occlude this side and do the whisper test, okay? And what I'm going to do is I'm going to say a two-syllable word, and you're going to repeat it to me when you hear it, okay?
Happy. Happy.
Okay? So that's the whisper test. And what that is doing is letting me know that you can hear the different amplitudes. What I'm going to do now is I'm going to take a peek inside your ear. And again, I'm looking at the tympanic membrane. And what I'm doing is I'm pulling downward on your ear. There it is. And I don't see it bulging, it's flat, so that means that there is not any swelling or problems behind that ear. I'm going to do it again on this side, okay? Again, I don't see any redness or drainage or any excessive accumulation of black. And it is clean membrane too, and it is flat. Okay. So now that your ears are within normal and you're able to hear, I'm going to move on to your nose and sinuses. We need you a different scope for that. And this is just an illumination test because I've already palpated and there's no pressure and there's no deviations and anything of that nature. So now what I'm looking for is just the hairs intact and the light, which you can see. Thank you. The things we do for healthcare, right?
Yeah.
Okay. So, for your next test, I'm going to have you close your, I'm going to close this one eye here, and I'm going to have you smell this what I'm gonna have you do, now that we've done your nose, I'm going to look at your, mouth and throat. Get another probe for that. Okay? So I'm gonna have you just, open your mouth for me. And again, I'm looking to see if there's any redness or any obvious lesions. Your teeth are intact, they're all your own. Yeah. I don't see any bleeding in the gums, or anything of that nature. Okay. I'm gonna get my gloves on. Okay. And I'm gonna open your mouth again for me. I'm just going to check the inner lining here. Feeling for softness, anything of that nature. All right, can you stick your tongue out for me? I'm going to grab a hold of it and just work on your, on your muscle strength. Pull it back in for me. Okay. And can you lift your tongue up to your top of your mouth there? Okay, and your frenulum is intact, so that's good. Yeah, there you go. You know the drill. Okay. All right.
It's a tongue depression.
All right, I'm going to have you say ah.
Ah.
And I'm just going to check your gag. Okay. And it is there. So, the uvula raises and the gag reflex is present. Again, no lesions or bleeding, so the mouth and oral mucosa cavity is okay. I'm going to look at the throat and neck, and so I'm going to start with the palpation again. I've inspected where the trachea was midline, and now that I've inspected that, I'm going to palpate. I'm not feeling any masses or lesions, and I didn't see any goiters when I was inspecting. Down here to the arch, and then I'm going to have you swallow. And again. Okay. And again, I don't feel any swelling in the thyroid or the lymph nodes at this point. So I'm going to move on to the trapezius muscle and just palpate down around the arch. Okay. I'm going to have you raise up your shoulders for me, please. Okay. And that's just checking your interior muscles there. Now I'm going to move on to the upper extremities, and I'm looking now for the muscle strength, again, the color, the any deformities. I don't see any swelling, any bulges, any bruises. All right, I'm going to have you hold your hands out for me, please. Straight up front, make a fist. I'm going to try and bend your arms. Don't make them. Don't allow me to. And up. Okay. I'm going to try and squeeze your hands together. And apart. And you're very strong. And I'm going to try and push down. And up. No hurt. That doesn't hurt when I try any pressure. Alrighty. And so your upper extremities don't look like they have any difficulties. Your pulses were good, brachial and radial. They're strong and equal. The color of his hands are normal. There's no arrhythmia there. Go ahead and turn your hands over. Do straight. There you go. I'm going to try and squeeze your fingers together. Yep, and spread apart. Okay, so you've got good turgor. And again, the nail beds that I previously said. There's no striae or clubbing, no discord. So your upper extremities are doing okay as well. There's no deficits or problems there that you'd like to report?
Nope.
No? Okay. So now I'm going to go on to the posterior, I'm sorry, the anterior chest wall. I'm going to drop this down just so I can take a look at your breathing. Make sure you're not using any accessory muscles. Your chest is rising symmetrically. And again, I'm just palpating it. Feeling your ribs, locating that notch. Okay. And I'm going to have you say 99.
90. 99.
Okay. And when I was feeling for it then, I'm feeling for the vibration, well, lets me know there's good air exchange and inhalation there at that point, and that's good. So now what I'm going to do is I'm going to listen to your lung sounds. Take a deep breath. Okay. Okay. And then I'm going to go to the back of you and look for your lung sounds at this point. Now while I'm back here, I'm going to be checking the curvature of the spine, your breathing pattern back here as well. I'll see lesions or rash or bruises here. And again, I'm going to take another quick listen to you. Take a deep breath. Can you say 99?
99.
Again?
99.
Again?
99.
One more.
99.
Okay, I don't hear any abnormalities or external vibration or adventitious breath sounds when you do that. I didn't hear that. All right, I'm gonna come down here to the no pain or tenderness when I do this.
No, it's okay.
So I'm finding the 12, 9, 10. So I need you to take a deep breath for me. Okay. And again. Okay, and what I'm checking through by doing this is the diaphragmatic excursion, which is how your diaphragm raises when you take an inhalation. And it's about 3 centimeters, about 2.5, 3 centimeters, which is normal, so that's good. It doesn't hurt when you take deep breaths like that.
No.
Okay. So now that I know that your lungs are clear and I don't hear any adventitious breath sounds, I'm going to listen to your heart sounds. I'm going to start with the aorta. Just breathe regularly. All around it. Mitral. Listen to the apex. Okay. And the axillary. And I don't hear any rubs or murmurs, no gallops either. There's just a regular thump thump, which is an S1, S2 sound, so that's good. So there's no abnormalities of the heart at this point that I can detect. Now that I've listened to your chest and I've looked at your, I'm going to go ahead and have you put this back up. Mhm. Thank you very much. And I'm going to, all while I'm looking at the carotid, the jugular veins, there's no pulsation, there's no signs of JVD at this point. So I'm going to have you lie down in the bed. Thank you. So now you get to take the load off. Okay. So again, I am looking for any pulsations, and what I would find at this notch is markers here. This will be my straight edge. And what you do the highest point and coming out above that. And that's about 4 centimeters, so that's within normal. There's no JVD noted there. I'm going to once again listen to the apex of the heart. sometimes it is easier to determine murmurs when people are laying down and versus sitting up because of the flow of the blood with the difference in pressure. So sometimes you want to reassess that. And then I'm going to palpate for any abnormal pulsations. Any tenderness when I apply pressure to the...
No.
Okay. There's no swelling. I cannot feel the anything down there at that point. Okay. So now that your chest has been ruled out of having any problem, I'm gonna lift your gown and look at your belly here, your abdomen. Okay. And again, I'm noting that your breathing pattern is easy. You can see the border of the ribs, but with the abdominal section, we want to look first and listen first, so I don't want to disturb anything going on in there. I don't see any swelling. There's no discoloration around the umbilicus. There's no distension noted. I'm going to just lightly make sure my stethoscope is warm still. And I'm going to listen in all four quadrants for bowel sounds, making sure I don't hear any high-pitched tinkling. Just a slight gurgle in each of the four quadrants, which I do. And then I'm going to come over here till the, using the bell, I'm going to use the aorta. And again, I don't hear any pulsating there, no brewing. And I'm going to work my way down to the femoral. And this side as well. Okay. And again, that was okay. So now what I'm going to do is I'm going to do some percussion, and what I'm listening for is the resonant sound of air across the abdomen, which is what should be over the stomach and the intestine. No dullness, which would mean that there's a fluid filled or ascites or bleeding possibilities. I don't see any of that or hear any of that. I'm going to do a light palpation, checking for any tender areas. I don't see any facial grimaces or anything of that nature, so I'm going to go into a little bit deeper palpation. No pain with that?
No.
I'm trying to identify. Everything is symmetrical. There's no distension. There's no fluid-filled areas noted. Now I'm going to go up to the border of the rib cage, and what I'm going to try to do is palpate the liver. And by doing this, you find that the border, you mark where it becomes dull over the intercostal space, not over the bone, otherwise you're automatically going to have a dullness. So that would be the first mark. And then you're going to come back down and find that mark. Now sometimes if you have the patient, if you'll take a deep breath, you'll inhale for me, and exhale. Okay, you can kind of feel, you can lift up and hook underneath there, take another deep breath now, and you can feel the tip of the liver. I do not at that point, which is not an uncommon finding. And I'm going to do the same thing over here for the spleen. Okay, and then I'm going to have you take a deep breath for me there. And I don't feel that. Now, if you could feel the border of the spleen, that could indicate a swelling. You should not be able to feel that border. And so that leads me to believe there's no splenic injury, there's no discoloration, there's no pain over McBurney's point with palpation. So it leads me to believe that their abdomen is fine. You're not going to have any nausea problems, vomiting, any problems with your bowels or Okay, so I'm going to move on to your lower extremities. And again, I'm just looking for symmetry, any lesions or an old scar there, but other than that, everything is intact. And what I'm going to do now is I'm going to check for sensation and touch again with the lower extremities. We're going to do it again and everyone.
Soft and sharp.
Soft and sharp. You know the drill. Okay, you're going to tell me where you feel. Soft or sharp?
Sharp. Soft. 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 Sharp. Sharp. Soft. Soft.
Okay, and I'm going to just do a quick
That
Re-
tickles.
reflex of the heels. And I'm looking for the Babinski sign, which is or a flailing of the toes, and of course that's not there. And the cap refill of the toes is good as well. There's no discoloration. There's a few varicose veins down here around the feet and ankles, but other than that, I'm going to have you push against my hands, point your toes down. There you go, and pull them back for me, please. Thank you. And what I'm going to have you just try to lift your leg for me. Lift it up. Oh, there you go. And put it back down. Put it back down. Here we go. And I'm feeling for your popliteal pulses at this point, making sure they're equal. Okay. I'm going to have you lift up on this leg for me too. Okay. Goes down. Okay. So your strength is good and equal, and there's no deficits there. There's no swelling around the knees. No edema noted on either extremity. I'm going to have you bend this knee up. And now I'm just going to check your range of motion. So I'm going to tilt it in as far as you can until you have pain or discomfort. Just go ahead and tilt it that way for me. No problems. Okay. And out. Okay. Free range of motion. No guarding or facial grimaces noted. So we're going to go ahead and get on to the next leg. So we're going to lift this knee up too. Do the same thing as what we're going to have you rotate over like you're rolling over in the bed. Okay. And out. There you go. All right, and put that back down. So your legs are fully functional, and no problems with your range of motion of the legs. Now we're going to move on to your neurological exam. So if you could just go ahead and sit up to the edge of the bed for me. Put your shoes back on here. Oh, sorry. Okay. Now, what I'm going to have you do is, what I'm going to have you do is I'm going to have you stand up for me, please. And I'm going to stay right there. I'm going to move this bed back a little bit so we're in view of the camera. That's the alarm for the baby's bed here. Put the brush back on. There it is. Again, I should have had music for this. Made it a little bit more fun. All right. All right, just take another step back for me just a moment there. All right, I'm going to have you stick your hands straight out in front of me, your eyes open, and then I'm going to have you close them and rotate your palms up. Alrighty, there's no sway or give or no drift at all, so they're both equal. Okay, go ahead and open your eyes and rotate them back to Palmer. Alright, I'm going to have you push down on my hands. Alright, and up. Okay. Now what I'm going to have you do is I'm going to have you stand on one foot. The other foot for just 1, 2, 3 seconds. And the other foot. 1, 2, 3, 4 good seconds. All right. Now I'm also going to have you just show me your normal gait. So I'm going to have you stand right here and walk. I'm going to go over here and I'm going to have you walk towards me, just your regular gait pattern. Turn around, walk towards me, and back. I don't see any limping. I'm checking the symmetrical of his hips and his back. The gait is steady and strong. Now I'm going to have you do some tandem walking, which I'm going to put heel to toe towards me and back. And again, there's no swaying, no deviation. Okay, good. And back. Okay, thank you very much.
I was running out of room.
That's fine, that's fine. I'm also gonna have you, not worry. I don't want you to worry. I'm not gonna hurt you. I'm going to, have you close your eyes and touch your nose for me? And your other switch? Okay. Alrighty, that's it. If you'll have a seat. I think that for overall your systems are very well and you are very healthy, and that there's not any real deficits or concerns at this time, which is always a good sign, but you always want to make sure that you're getting your hearing checked more than every 10, 20, or 30 years, and what have you, and do your annual follow-ups with your doctor, and I will go get him for that.
Okay, thank you very much.
Thank you.